E-Mental Health and the Modern Mind: Developments, Dangers, and Destruction. Edited by Austin Martin and Catherine Martin. Written by Peter Anto Johnson, John Christy Johnson, Shauna Harline, and Robert McWeeny. Narrated by Min Ngo. Chapter 9: Kids, Mobile Apps, and Generational Gaps. The cost-benefit yield of information technology can be unapologetically double-sided. The information age has imbued speed, power, and capability into our most critical social and economic institutions. However, detriments like human over-reliance and personal data vulnerabilities beget public skepticism around how and to what extent infotech is utilized in societies. Psychiatry has experienced no shortage of advancements in information technology. To practitioners, innovations in this field often represent a revolution in workflow. Computational methods help streamline diagnosis and treatment. Remote therapy solutions mend care access disparities, while other modern tools help ameliorate mental health care processes. Until the last decade of 2010 to 2020, mental health information technology seldom catered to consumer-based usage models. Advancement efforts in this area were most often dedicated to improving efficiencies for practitioners and officers of mental health care. With information technology now perforating client-practitioner care models, mental health institutions took notice of shortfalls in technology utilization for patient self-care. Development of the first e-mental health tools for public use began as early as 1999. From a user's experience, these platforms were often cumbersome, relying on early incantations of computing and internet that were unable to fully optimize a user's experience, thus pushing e-mental health toward the category of fringe and boutique research. Until computation and network efficiency could contend with user preferences, accessibility issues continue to stifle successful adoption of e-mental health tools, keeping them obsolete, out of sight, and out of mind to the general public. However, with the explosion of next-gen mobile technology such as smartphones and advanced mobile networking in the late 2000s, e-mental health took an unexpected leap into its new chariot: mobile apps. With mobile app development becoming more affordable and captivating for users, proprietors of e-mental health discovered a gateway to bolstering mental health for children and youth through applications compatible with their smartphones. Children and youth inhabit a particularly daunting demographic in terms of engagement and accessibility regarding the uptake of healthcare education, resources, and patient self-care. When soliciting the attention and patronage of children and youth, healthcare practitioners must contend with demographic exclusive dynamics in order to fully access and leverage young people's attention. With careful consideration of tone, style, colloquialisms, and popular culture, it is possible to craft products and communications material capable of honing the consideration of young people. However, therein lies a fundamental problem for e-mental health's proprietors. Healthcare institutions are not inherently competitive marketers. What's more, mercantilistic app and entertainment developers understand the finite nature of youth attention and prioritize out-advertising other competitors eager to capture the attention of young people. How is one to contend with dominant market forces despite the potential public good of an e-health product? While there may be no clear-cut answer to this quagmire, it is worth considering that healthcare is a part of a broad
Sample complete. Ready to continue?